NetNewsLedger. Please go ahead.
Well, good afternoon again from Western Ontario and the best part of the province, Premier.
Great. Always good to hear from the folks in Western Ontario.
Now, this announcement today on additional mental health support, this is a good start. What we see here in Thunder Bay in particular is we have a lot of the calls that our Thunder Bay Police Service respond to, which are mental health related. We get people into the jail system. The jail in Thunder Bay, I don't know if you've toured it, but it looks like a medieval castle and the conditions are terrible. What can be done to help people in Northwestern Ontario, Northern Ontario, and Western Ontario to become, addiction-free? The jails might be a start, but what we're seeing is a lot of people released on conditions, including no drinking and no drugs, but they have an addiction issue. So even if the court system is giving them counseling, how are we going to make this work?
Yeah, I'm going to hand it to my ministers, but something, I've seen it firsthand when I've been up to Thunder Bay, and it's concerning. But I'm going to pass it over to the Solicitor General and then over to my Minister of Mental Health.
Well, thank you for the question. You're absolutely right. That is why we have done the pathway to wellness, because we understand that it is cross-jurisdictional, it is cross-ministry. And in Thunder Bay in particular, of course, we have made the announcement that we are rebuilding a new jail in Thunder Bay to acknowledge the fact that their numbers continue to increase. But the mobile crisis teams that are being embedded with police officers, as those 911 calls come in, and we're seeing upwards of 45% are actually mental health related calls, it is truly going to be a game changer to embed mental health workers with police officers so that when that phone call is made, the connections with the community supports are there and can happen immediately. I'm very excited about this announcement, and I'm so pleased that we've been able to work together across government to make it happen. And I'll turn it over to Minister Tabolo.
Thank you, Minister. Addictions and mental health is something that the government has taken very seriously here in the province of Ontario. Appointing me the First Minister responsible has given me the opportunity to work with my colleagues across ministry and be able to look at the issues, the fundamental underlying issues when it comes to addictions and mental health. I've had the opportunity to tour most of the province, from remote communities to the rural communities, and of course the different communities in the GTA. And one of the things that we understand is that mental health really weaves itself into so many different aspects of who we are and what we do in the province. Thunder Bay in particular needs support, as do many of the other communities. And what we're doing with the Roadmap to Wellness is developing a strategy that actually connects the existing services, and where the gaps exist, look to put those services in place. And our initial investment of $174 million last year, $176 million this year, and an additional $174 for $350 million, is looking to identify those gaps, working with stakeholders and listening to the people of the different communities so that we provide the services and supports where and when they're needed. And we know that by doing this, we're going to make a difference. It's going to take time, because this government is the first government that's made such an historic investment in mental health and addictions. But we're starting to see the results already with collaboration between different service providers, looking at strategies that are unique to each of the communities, because circumstances change depending on where you are in the province. So we're continuing to do that work and continuing to implement our strategy. And with an investment of $3.8 billion over 10 years, we will make a fundamental difference to addictions and mental health across the province.
Follow up?
Now, that's a good start again, and I think we're on the right track here. Some of the areas that are still lacking seem to be in victim services, so families aren't getting some of the support they need. Will this be available in this program?
I'll pass it back to the Solicitor General.
So absolutely, the Ministry of the Attorney General is also part of our cross-jurisdictional, cross-ministry approach. We understand that when an individual has a mental health crisis, their family also needs support. So what we are doing is making those investments both at the victim side and with the individual. And again, I must reinforce, the The need for us to look at mental health across the continuum of care is so critical. We have been doing that as a government by having Minister Tabolo lead a standalone ministry, but it is because of the cooperation that we have with the Municipal Affairs and Housing, with additional supports, with the Attorney General, victim supports, with the justice sector, with embedding mental health crisis workers, with the hospital patient transfer that allows police officers to be able to transfer in a much smoother and respectful way individuals who are in a mental health crisis to our emergency rooms without further stigmatizing them by having them sit in a waiting room for 4 to 6 hours. There are so many pieces that we are working together with from a ministry standpoint that I believe that you will see true transformations of this sector and people will get the help where they need it, when they need it.
Thanks everyone.
Thank you, everyone.